I'm Dr. Zach Shields at Elite Sport and Spine, and in this video, we're going to go over what we do from a chiropractic standpoint for a golf assessment. So we have Noah here again to help us with our assessment. We're going to start with a rotation. A lot of times we'll just use this dowel if someone brings a club in so we can evaluate what their swing looks like. We'll have them hold an iron this way, but he's going to hold it in the crease of his elbows with his arms crossed in front of him on either shoulder. We're going to have him get into a half squat position or kind of a golf stance, and then he's going to rotate from here. So this allows us to kind of evaluate what thoracic spine rotation looks like, as well as how well he's able to rotate through the hips. Ideally, we want to see that bar get to perpendicular to the floor. And as you can see, Noah does a pretty good job here of rotating. It looks like he's doing a little more work to get to the right than he does to the left. But otherwise, that's pretty good. Then the next thing we're going to do is going to be a squat pattern, again, just to see how well he's able to stabilize his lumbar spine and move through the hips and lower extremity. So I'm going to have him put the bar along his back, and Noah, I'll have you turn so that the camera can see this from a side angle. So we want the back of his head, his mid-back, and his tailbone to be touching the bar. And then from there, he's going to go into a deep squat, ideally getting down to about parallel, evaluating that he's able to keep his heels on the ground, that he's able to sit back into that squat and keep a relatively neutral spine as he's going through that. Perfect. You can set that bar down then. And then the next thing we go through is taking a look at hip rotation. So let's have you lay on your back first. And this should look pretty similar to what Tyler went through. So let's have you bend this knee. We're going to bring this knee all the way up, evaluating for hip flexion first. Any pain or discomfort there at all? From here, I'm going to bring the knee out and the foot in, looking for external hip rotation. And then we'll bring the knee in and the foot out, looking for internal hip rotation. If there was any pain or discomfort or restriction there, that would be something that we would address. Then let's have you flip all the way over and go face down. And similar thing here, looking for hip rotation with the hip in a more neutral position rather than a flex position. So I'll have you bend your knee here. And then we're going to move the foot side to side, again, evaluating for external rotation, and then again for internal rotation. And we would do that on either side. That's just kind of a quick overview of what we're looking for in a golf assessment. Obviously, we're looking to evaluate thoracic spine mobility, hip mobility, and then how well he is able to move through the hips and stabilize his lumbar spine with some complex movements.